Hello everyone. I hope everything is going well with you during your preparation throughout the lab journey. Today I want to upload a video for doctors who are preparing for lab 2, which is an important station, very challenging and a very easy one, which is the Simman station. We have about 13 scenarios in Simman. I would like to start with the most common, most easiest station, which is the asthma station. So let's start. When you find on the door of the station, you will see that you are FY2 in A&E, whatever the patient name. Let's say him Jack. Let's call him Jack. Whatever the age, 30, 40, he came with acute shortness of breath. Please talk to the patient, assess him, examine the patient, and then discuss the plan of management with the examiner. So we will enter the station, say loudly your name and GNC number, and you will verbalize that you assume you take all universal precaution. Then you will go to the patient. Hello, introduce yourself, confirm the patient name and age, and then what brought you to the hospital, how can I help you? He will tell you, I can't breathe, doctor. He may tell you, my asthma is killing me. He may tell you, I can't breathe, doctor, and stop. Then you will elaborate more about this. I'm here to help you, this IPS. May I know, tell me more about it, what happened? I have shortness of breath. When did it start? It started like 2 to 3 hours ago. How did it start? I was just sitting, doctor, at home, and it started suddenly. Has it happened before? Yes or no, doctor? He may tell you that, yes, doctor, I'm asthmatic, it happened before. I was hospitalized for 1 or twice before with the same problem. Okay, so how is it managed? If he tell you that he has asthma, yes, doctor, I'm taking blue inhaler. And are you taking it regularly as prescribed? Yes, doctor. When was the last time? He may tell you in the morning or 1 hour before. Okay. So excuse me, can I check your vitals and come back to you? You will go and verbalize loudly all the vitals. You will find that the heart rate, it might be high, above 90 to above 100, or it might be normal. You will verbalize high blood pressure, normal, respiratory rate like 30, 35, it will be high, and saturation may be 80s. So you have now patient unstable vitals. Any patient with unstable vitals, you will verbalize that I would like to, as my patient is vitally unstable, I would like to proceed for A to E approach and reassess after that. And you will start A for airway. As I will verbalize, as my patient is alert, conscious, so the airway is patent, I would like to give my patient 100% oxygen via non-breather face mask, 15 liters per minute, after ruling out COPD, because COPD will not give the patient 100% oxygen. And then you will go and pick the face mask and go to the patient, tell him, I would like to give you some oxygen to relieve your breathing. Do you have any smoker's cough? No, doctor. Okay. And gently, very gently, you will put on the Simman, the face mask, and wait for 1 second, check the vitals. You will find that the saturation is going up, it's improving. And then you will ask the patient, how do you feel now? He will tell you, much better, doctor. Okay, nice to hear. Now I would like to go for breathing. You will tell the patient that I would like to examine you. I would like to undress you. I have a chaperone to ensure your privacy. Shall I proceed? Yes, doctor. Okay. Then you will start to gently remove the sheet from the chest, all over the chest, and have a look on the chest. The chest rise is equal on both sides. Then with your hands, try to encircle the chest. Ask the man to take deep breath in and out to assess the chest rise, if it's equal on both sides or not. Then you will tell him, I would like to touch your neck and comment on the trachea, is central or not. And then I would like to tap on your chest. You tap on 6 parts, different parts on both sides of chest. And they will comment that by percussion, no hyperresonant or dullness on percussion. Then I would like to listen to your chest. You will pick up the stethoscope and listen to the chest on 6 parts on both sides and compare between right and left side and comment that I find that I can hear that fairer entry on both sides of the chest and I can hear wheezes. So I would like to give my patient a nebulizer, salbutamol via nebulizer and back to back with Atrovent for the first hour, every 20 minutes. After that, you will go to the patient and tell him that there is noisy breathing and I would like to give you some a nebulizer to relieve your breathing. Okay, doctor. So you will verbalize, I would like to give 5 milligram salbutamol back to back with 500 microgram ipratropium bromide nebulizer to my patient for the first hour and reassess. Continuously try to tell the examiner that you are going to reassess and follow up the patient and evaluating the vitals every time, every 15, every 20 minutes. After you give the patient the nebulizer, then you will ask him, how do you feel now? He will tell you, much better, doctor. Okay, that's nice to hear. I would like to proceed for C for circulation. Then you will have a look on the patient. You will comment on the pulse on both sides with back of your hand on his hands and assess for cold preference on both sides. I would like to squeeze the tip of your finger, ideally for 5 seconds, and assess the capillary refill time. As long as the heart rate and the blood pressure are stable, so suppose the capillary refill time will be normal. And check for any cyanosis, any pallor, and you will comment on the heart rate and the blood pressure. If the heart rate and the blood pressure are normal, then you will verbalize that I would like to insert one large wide pore cannula to withdraw bloods, routine bloods, including liver kidney function and arterial blood gas. And after that, circulation is not finished. You will go to examine the heart, listen to the heart, comment on the heart sound, no added sounds. And I would like to connect my patient to 12 leads ECG. This is for C. C, you will comment on peripheral signs of perfusion and comment on heart rate, blood pressure. If they are normal, you will insert one large wide pore cannula for bloods and ask for arterial blood gas. And then proceed to examine the heart and comment on the heart. And then connect the patient to the 12 leads ECG. At this point, you finish C. I will tell you later in the coming videos if the heart rate and the blood pressure are unstable. So what will we do and what type of fluids, intravenous fluids, we will give and what amount. Okay. Then we finish C. We will proceed for D. D for disability. Disability, we have 2 items. We have to comment on them in every stations. Whatever, if the patient is have any disturbed conscious level or blood sugar, we are suspecting there is abnormality. Every stations, we have to comment on the disability. We first off the GCS, Glasgow Coma Score. You can ask the patient gently, Jack, do you know where we are now? He will tell you in the hospital, doctor. Okay, so my patient is alert, oriented. So GCS is 15 out of 15. And the other part of the D disability is bedside random blood sugar. Okay. After that, you will proceed for exposure. You will gain such another consent or verbalizing that I would like to examine you fully from head to toe and examine if there is any abnormality. At this point in exposure, you will have a look on the chest if there is any rash. Then you will go down to the abdomen. You will touch the abdomen for any like any tenderness, any rigidity, and then listen to the abdominal sounds, comment, and then you will go down to the legs. If there is any swelling and you have like you are acting like you have a measuring tab and measure the both cuffs, and then feel the dorsalis pedis pulses on both sides of the feet. At this point, you finish exposure. As long as temperature is normal, so you will not interfere with intravenous paracetamol. It's for cases with high temperature, as in sepsis. After finishing exposure, you will verbalize that I would like to reassess again from A to E, and to assess the interventions what we have done and the response to it. At this point, you finish A to E, and this is the main bulk of the station. And you verbalize that you will reassess again. That's very important. Then you will summarize again what did you do, that the patient, saturation, name and age, and what did you do in A to E. You will go to the patient and tell him that Jack, having listened to you and examining you, you have a condition called the acute exacerbation of asthma. Keep an eye on the saturation all over the station. After every component of the E and E, you have to keep an eye on saturation. If the saturation is normal, above 95, so you are on the right way, or you finish your station mostly. If you find the situation going down again, so you will ask the patient, are you able to take oral? If he tell you yes, so you will verbalize, I would like to give my patient oral prednisolone. If he tell you no, you will verbalize that you would like to give your patient intravenous hydrocortisone 100 milligram, up to 250 milligram. Then now you can start at this point. If the examiner didn't interrupt you or ask you what next steps, you can continue taking history from the patient. That has it happened before? Have you noticed any high temperature, any flu symptoms? And ask about the compliance of the blue inhalers, any other medical condition, any known allergies, and ask about smoking, very important, any pets or carpets at home. If at this point you almost 99% you finish the station. If the examiner stop you and ask you what the next step, doctor, if my patient deteriorates, I would like to discuss with my senior to review you for further plan of management, like intravenous magnesium sulfate or intravenous salbutamol or intravenous aminophylline, and I would like to inform the ITU for life-threatening or near-fatal asthma. At this point, you almost finish the station. If you wanted to know about the doses of magnesium sulfate, it's 2 grams intravenous infusion over 20 minutes. Salbutamol 250 microgram intravenous bolus, and that's it. Aminophylline is 500 milligram per kilogram intravenous infusion over 20 minutes as well, and that's it. The station is almost finished. Thank you for listening to me. I would like to upload the next 12 stations very soon. Have a best of luck in your preparation, and thank you.